Hi everyone. In this video, we're going to give an in-depth analysis of aphasia. We hope you enjoy. Aphasia is a language disorder that does not allow an individual to fluently express their thoughts while comprehending language. It can also impair one's ability to understand language, even though they can speak fluently. There are two common types of aphasia: Wernicke's and Broca's aphasia. The Wernicke's and Broca's areas are located in the left cerebral hemisphere of the brain, and they both control the functions of language. Wernicke's area is located in the left temporal lobe of the brain, and its function involves comprehending language, especially speech sounds. Injuries to the Wernicke's area results in Wernicke's aphasia, where an individual faces great difficulty in understanding speech, but yet can converse fluently. Broca's area is located in the left frontal lobe, and damage to the Broca's area results in Broca's aphasia, where the individual has difficulties producing complete sentences but can comprehend other speech. Aphasia is caused by damages and/or injuries to those specific areas of the left hemisphere of the brain caused by stroke, brain tumor, dementia, or infection. Often, aphasia is caused by stroke, and it affects up to 42% of stroke survivors. Regardless of age, race, and gender, anyone can develop aphasia. However, some groups that have a lower socioeconomic status are at a higher risk of poor neurocognitive outcomes during their post-stroke recovery like aphasia, and they also have an increased risk of stroke and traumatic brain injuries. This is due to their low socioeconomic status, and they have lower access to proper healthcare facilities, as well as decreased health literacy. Aphasia greatly impacts an individual's mental health and social life, as it disrupts their daily functions used for speech. Moreover, aphasia further imposes many limitations on an individual's quality of life, which can be associated with unemployment and social isolation. There are various treatments for individuals affected by aphasia, and we are going to present to you 5 possible treatment options for aphasia. The first treatment is melodic intonation therapy, which utilizes musical elements of speech such as melody, rhyme, and stress through singing. They begin by singing simple phrases, and then over time the phrases include larger syllable length. Melodic intonation therapy is used for those with non-fluent aphasia to improve their expressive language. The second treatment option is conversational coaching. Conversational coaching teaches the patient and their primary communication partners both verbal and non-verbal communication strategies. In conversational coaching, the patient and their primary communication partner are taught both verbal and non-verbal communication strategies. The communication strategies are drawing, gesturing, confirming, and summarizing information, and these are practiced in scripted conversations. Next, we have oral reading for language and aphasia. It is a reading treatment where the patient has to read phrases out loud in order to improve their reading comprehension through phonological and semantic reading routes. The next treatment option is semantic feature analysis, where the patient identifies significant semantic features of their target word that is challenging for them to retrieve. As an example, if they face difficulties retrieving the word stove, they will be prompted with questions related to that word, like where is it located, which is in the kitchen. Lastly, we have constraint-induced language therapy, which primarily focuses on encouraging spoken language and limiting the use of written language and gesturing. Note that there are many other treatment options that are better suited for an individual and can be discussed with the clinical professional. In this slide, we have listed some clinic options that you can check out in Canada and America that provide treatment options for individuals affected by aphasia. Aphasia treatment costs are very expensive. Today, treatment costs for aphasia per year will cost the patient around $3,000. Sadly, many individuals from marginalized communities impacted by aphasia are not able to afford treatment due to the high costs. So how can you help? charitable organization of the speech and auditory disorders will be raising funds and donations for individuals affected by aphasia who cannot afford treatment. With your help, we will be able to aid these individuals to gradually regain their speech, which is very important for communication and daily life. Your donations and funds will go a long way for their recovery from aphasia. Thank you for listening. We hope you enjoyed our video and found our content to be useful. From myself and the rest of the COSAT team, we wish you all the best, and until next time, take care.